and thank you for listening to today's episode of JATCast, the official podcast of the Journal of Athletic Training. I'm your host, Luke Donovan. For this second episode of the month, I will discuss another article about concussion assessment tools from the upcoming issue of JAT titled King-Devick Test Reliability in National Collegiate Athletic Association Athletes, a National Collegiate Athletic Association Department of Defense Concussion Assessment Research and Education Report by Dr. Katherine Breedlove and colleagues. As a reminder, the article discussed today can be found on the JAT website, natajournals.org. And please remember that all content from JAT is open access to all readers thanks to the funding from the National Athletic Trainers Association. First step, surveying the scene. On the previous episode, we summarized the primary findings of a study that examined the relationship between the King-Devick test and other commonly used baseline concussion assessment tools. The study found some weak relationships between various tests. However, the King-Devick test largely did not overlap with the findings from the other evaluation tools. As such, the King-Devick test may be an additional tool that should be regularly included in baseline testing and post-concussion management. However, prior to doing so, the repeatability of the assessment tool must also be further established. The King-Devick test was originally developed to evaluate horizontal saccadic performance as part of a reading evaluation in children in the mid-1970s. In 2011, the test was adapted for concussion screening. Given the numerous neural connections pertaining to vision within the brain, the inclusion of visual evaluation as part of the battery of concussion assessments seems logical. The test can be completed in around 2 minutes and is shown to be sensitive to vestibulo-ocular changes caused by concussion. Provided that many concussion assessment tools, such as the King-Devick test, require multiple trials within a testing session, are administered annually to continuously establish baseline norms, and can be administered throughout different modes, it is imperative to understand the reliability of concussion tools that match these common practices. Therefore, the authors of this article described 3 primary aims, which were to assess the test-retest reliability between trials, establish test-retest reliability between 1 and 2 years, and to measure reliability stratified administration methods, being either the spiral-bound cards or tablet application of the King-Devick test. A little over 3,000 individuals from 29 universities participated in the study. Prior to the participants' sporting activity, a baseline King-Devick test using either the spiral-bound cards or tablet was administered. As part of the standard instructions of the test, 2 trials were administered. Tests were repeated using the same delivery mode on an annual basis. To replicate clinical practice, the study team did not require the same investigator to administer the test between years. Here are the results. The King-Devick test had good reliability between trials, between year 1 and year 2, and also displayed good reliability for both the spiral card method and also the tablet application method of administration. Beyond the good reliability, it was noted that the scores, which is a measure of time, improved between trial 1 and trial 2 and improved from year 1 to year 2, suggesting that a practice effect does occur. This practice effect occurred regardless of mode of administration. It is important to note that although most participants improved their score by approximately 2 seconds over the course of the year, 27% of participants did demonstrate a worse score at the 1-year follow-up test. Overall, and with incorporating the findings from the study by Dr. Clugston, the King-Devick test is a reliable tool that adds unique information during baseline concussion assessments. Clinicians should continue to complete 2 trials when administering the test, as most student athletes will improve their score by an average of 2.4 seconds on the second trial. Also, since 27% of student athletes had worse times upon the annual reexamination without the influence of an injury, clinicians should not solely rely on the King-Devick test as baseline assessment and should continue to use a battery of assessment tools to capture all domains related to concussion. Both the spiral cards and tablet version of the test had similar retest reliability, so either can be used. But once a mode is selected, the same mode should be used going forward for retests. We should be on the lookout for future studies that replicate these measures within patients who have sustained a concussion, But in the meantime, these studies provide additional evidence to support and encourage the use of the King-Devick test as part of the multifaceted battery of assessment tools within baseline concussion evaluations. Well, that's it for today's JATcast. Please remember to rate and subscribe to the podcast, which is available on iTunes, Google Play, Spotify, YouTube, and Stitcher. You can find out more information about upcoming podcasts and other JAT events on our Twitter, Facebook, and Instagram accounts at JAT_NATA. Thank you for listening, and keep a lookout for next month's JATcast.